Why is high blood pressure allowed after an ischemic stroke? Imagine your brain as a busy city with roads that sometimes get blocked. When a blood clot blocks an artery causing an ischemic stroke, parts of the brain don't get enough blood. In the early moments after this happens, doctors often allow or even encourage high blood pressure. This might seem counterintuitive, but it's actually a carefully thought-out strategy called permissive hypertension. The goal is to keep blood flowing to the brain tissue that's at risk but not yet permanently damaged. High blood pressure can help push blood through smaller, alternative pathways called collateral vessels. These vessels act like detours around the blocked road, supplying oxygen and nutrients to the vulnerable areas. If blood pressure is lowered too much during this critical time, it could reduce blood flow and cause more damage. That's why doctors avoid lowering blood pressure aggressively right after an ischemic stroke. They want to prevent the brain from suffering further injury due to inadequate blood supply. There are specific blood pressure thresholds that guide treatment. For patients who are eligible for clot-busting drugs, blood pressure needs to be lowered below 185/110 millimeters of mercury before treatment. After receiving these medications, the goal is to keep blood pressure below 180/1054 at least 24 hours to reduce bleeding risks. For those not receiving clot-busting therapy, higher blood pressures up to 220/120 are often tolerated initially. Lowering blood pressure too early or too much in these cases has not shown clear benefits and might even be harmful. After procedures like mechanical thrombectomy, which physically removes the clot, blood pressure targets are usually set below 180/105. This helps prevent reperfusion injury, which is damage caused when blood flow is restored too quickly. But at the same time, it's important not to lower blood pressure so much that the brain doesn't get enough blood. The relationship between blood pressure and stroke outcomes is complex. Both very high and very low blood pressure can worsen recovery. High blood pressure increases the risk of bleeding and swelling, while low blood pressure can cause the brain to become starved of oxygen. Because of this, managing blood pressure after an ischemic stroke requires careful, individualized monitoring. Research shows that routine early lowering of blood pressure in ischemic stroke doesn't always lead to better outcomes. Unlike hemorrhagic stroke, where lowering blood pressure is more straightforward, ischemic stroke treatment is more nuanced. Guidelines recommend a cautious approach, treating only when blood pressure reaches levels that could cause bleeding or interfere with treatments. In some cases, doctors might consider raising blood pressure temporarily if a patient has poor collateral flow and is not responding well. But this is usually done in clinical trials or specialized settings, not as standard practice. Close monitoring of neurological and heart function is essential during this process to ensure safety. In summary, allowing higher blood pressure after an ischemic stroke is a strategic choice to support blood flow to the brain's vulnerable areas. Lowering it too quickly or too much could do more harm than good. Treatment decisions depend on individual circumstances, whether reperfusion therapies are used, and current medical guidelines. Always consult healthcare professionals for personalized care, as each stroke case is unique and requires tailored management.